Measles, also known as rubeola, is a highly contagious respiratory infection that's caused by a virus. It's even more contagious than tuberculosis and Ebola. One sick person can infect as many as 18 other persons. Measles causes a total body skin rash and flu-like symptoms, including a fever, cough, runny nose, red eyes, as well as white spots inside the mouth. Before a vaccine was developed in the early 1960s, the disease once killed millions across the world. The last time Belize had a case of measles was in 1991. But in recent years, the disease has been spreading across Europe and the Americas. And even closer to home, recently 2 cases were detected in the region, one in Guatemala and the other in Antigua. There are no known cases of measles in Belize at this time, but health officials say it's just a matter of time.
The risk is there because of the tourism season that we are in currently. The cases that have been documented in the Americas are all linked with importation. The case in Guatemala was an importation, and the case in Antigua, now that is confirmed, was an importation also from Germany and the UK.
And the numbers are on the rise in the Americas annually.
The numbers are on a rise in the Americas. Comparing 2016 and 2017, it was 92, and then it jumped to 271 in 2017. So it's coming. Since the last case diagnosed in 1991, any one case in Belize, any one positive case diagnosed by laboratory would be an outbreak for Belize. And it would imply multiple interventions at community level that will need a lot of resources, because we would need to go and work around that one single case in a radius of almost 3 miles to ensure that everyone there is updated with their vaccine and to provide vaccine to who doesn't have it.
And so it's important that you know the facts about this highly infectious disease that is a threat to public health. About 90% of those who have never been vaccinated for measles or never had the disease before will get the disease if they're exposed to someone infected. Measles spread primarily through coughing and sneezing. The virus remains active and contagious in the air or on infected surfaces for up to 2 hours. Those infected will be very sick for about 7 to 10 days. The most at risk are babies, as well as HIV-positive persons and others with immune deficiency disorders. But it can also affect people of all ages, and frontline personnel are at high risk.
Any baby less than 5, those are the ones who get the most complications from it. The people who are most at risk of getting or transmitting the disease, though, and hence the invitation of the media, is to make sure that all the population are vaccinated, especially the upfront personnel such as the immigration officers, the police officers, healthcare workers, of course. And so the Ministry of Health is starting this, or revamping the program to vaccinate these at-risk populations. The vaccinations that are given at a year and then at 18 months again. So there's 2 shots that are given to the population.
There is no treatment or cure for measles, but once you've been vaccinated, whether recently or long ago, it is highly unlikely that you will get the disease. The vaccine is highly effective, preventing 20 million deaths between 2000 and 2016.
The vaccine is safe and effective, and what we're asking is persons that may come in contact with potential persons bringing the disease to Belize, they need to review their vaccination card, and if there is no signs of they getting measles vaccine, then they would need to come to us.
The first MMR, it goes, you're protected 95%. If 100 people get it, 95 are fully protected.
Yes.
The second one tries to protect the other 5%. So it takes your personal protection up to 99.8%.
Yeah.
While there are no known or reported cases in Belize, if you experience symptoms like fever and rash, you must report it immediately. While the chance of a person dying by measles is very low, there are a number of complications associated with the viral infection.
Even though it is very, very contagious, the mortality, the people who die who get it is pretty low. The morbidity associated with it, though, the blindness, problems with learning down the road, is at about 30%. Hence our need to be aware and alert.
Preventative measures include vaccination, the washing of hands, covering of mouth and nose when coughing and sneezing, avoiding contacts such as kissing, hugging, sharing of utensils with measles-infected persons, and if there's someone showing signs and symptoms, report it to a doctor or nurse and avoid contact with others. Reporting for News 5, I'm Andrea Polanco.